So thank you everyone for attending today's session. This is our final session for the day for Tuesday, September 14th of the 2021 North Country Leadership Summit, Emerging from a Year of Change, an Opportunity to Rebuild and Reimagine. Before I introduce our presenters, I just want to give a quick shout out to our sponsors. These sponsors are what make this event possible, so we always thank them for their continued support, and we're happy to have them on every year. And just a few housekeeping items for today's session and for all of our sessions throughout the week. We're asking that you place all the questions and comments in the chat, and we will ensure that your questions are answered during the Q&A portion of the session at the end. We're keeping all of you muted and video off. That just ensures that the best broadband connectivity is possible. And lastly, the presentation will be recorded. The slides will also be archived on the North Country Leadership Summit webpage by October 1st. With that, I'm going to turn it over to Molly and Tess, and I'll have you guys share your presentation right over mine, and I'll hop off camera.
Great, thanks, Sarah. All right, let's pull this up. Can everyone see that?
Yeah.
Yes.
Okay, perfect. Thank you. So thank you, Sarah. My name is Molly McCann-Mall, and I am the Associate Director of Diversity, Equity, and Inclusion Initiatives at the Alzheimer's Association of Northeastern New York. And I'll go ahead and let Tess introduce herself as well.
Absolutely. My name is Tess Thierbecker. I'm a medical social worker at the VA hospital in Albany, and I'm currently with the Caregiver Support Program.
Excellent. So I'm excited because Tess and I are here this afternoon because we're going to talk about a partnership that we actually built and made even stronger throughout the pandemic, which is quite a feat. So we're going to be talking a little bit about how the partnership started, how we made it more strategic, and how we also made the partnership more formal, still bendable, but a formal relationship. And then also the events and roles that our organization decided to work on together, and how we both structured ourselves internally in order to be able to build on this partnership. So to get started, I want to just review a little bit about our organization. So at the Alzheimer's Association of Northeastern New York, we are a voluntary health organization. We do have in total 17 counties. So that is quite a big territory with over 50,000 people living with Alzheimer's disease or affected by Alzheimer's disease in those communities. I will say that all of our services are free. We do have full-time program managers in each one of our 17 counties. We're very fortunate to be able to do that. With a grant from the New York State Department of Health. And what's most important as well is some of our programs that we sort of expanded during this partnership with the VA. But I did want to just let all the attendees know about what we provide free in the community. So we do have a 24/7 helpline. That helpline is staffed by social workers, and it's run at our home office. But we know with Alzheimer's disease, it's not something that just happens during the day. We know a lot of families are affected late into the night at all hours. So it is an amazing service that families can call the helpline and get support from a dementia care specialist on how to handle a difficult situation, or maybe they're just looking for some basic information to be sent to them via mail or email. And the helpline can do that really quickly and has access to all of our local resources. And what is really nice too is we're actually able to see who's called into the helpline on a local level to our chapter. And all of us in the Northeastern New York chapter reach out to our constituents in the counties that have talked to our helpline. So it's a double layer of support, and we make sure that folks know that we're here on a local level as well. We also have our care consultations, and this is a one-on-one opportunity for families to meet with one of our program managers or one of our staff members to learn more about the disease, to learn more about communication tactics, behavioral issues, and even community support and resources. So one thing that I'll mention later in this presentation is how we kind of built on the care consultation model internally and expanded that service with the VA. Typically, because we're not care navigators or case managers as a voluntary health organization, we're taking appointments with families that call us or are referred to us and are open to meeting, but we're not doing the ongoing follow-ups. But with the VA, I'll explain that we're able to actually do that with the veterans that we're serving in this program, which is really nice. We also have support groups. We have over 30 in our 17 county radius. They cater to caregivers mostly, or any care partner. We have a variety of specialty support groups too for folks that are living with the disease, for sandwich generation or millennial caregivers. And we will soon have a Spanish support group. And then last but not least is a big piece of what I do, what a lot of my colleagues do at the chapter is education programs. So throughout the community, and maybe some of you have been to some of our education programs in the past, our goal is to really get the awareness out about the disease with some of our education programs. So talking about the warning signs of the disease and what is Alzheimer's disease versus dementia. But then we also have more specific education programs for care partners or for caregivers that talks about how to take care of your loved one and what to expect with the disease and the stages of the disease. So we do this all over. We're always looking for partners to be able to do this. We partner with a lot of community-based organizations, a lot of different folks that we do this with, but if you're interested, we are available to partner. And just to give you a little overview of our strategic objectives at the Alzheimer's Association. So one of our biggest pieces is really increasing the concern and awareness around the disease. We do know that there is, or it is normalized to be forgetful when someone is aging, and we're really trying to break that stigma and say that problematic memory loss is not a normal part of aging. So it's getting out the information to the community and understanding what the signs and symptoms are of the disease, so families are more equipped. We do see that when we're working with a lot of families, they're not even at the point where they have gotten a diagnosis, and they have been going through some challenging times for several years. So we really want to get the awareness out there about what the disease is. So we're catching this, and we're able to get a diagnosis earlier. We also have a public policy team, staff-wise in New York State, but we also have volunteer ambassadors that work on public policy and work with elected officials to advance what's coming up next, care and support for individuals with Alzheimer's disease and dementia. And as you can tell, we continue to want to provide free services to anyone affected by the disease. So we want to enhance the care and support programs that we have for all of our community members and all the counties that we serve. And we also are the biggest nonprofit funder for research in Alzheimer's disease and other dementias. So a big piece of our work too is talking about the new research, getting out there, how important it is to be a part of clinical trials. And I am very happy to say that within our chapter, we actually have a leader for research in New York State, and it's our executive director. And she's able to do presentations and talks about research in the community, and she does them often. Something, if anyone's interested in, we can have her speak, and she can talk about the advancements and also the amount of work that we need to do in order to find a cure. And then last but not least is growing revenue in support of our mission and care and support. And I did just want to let everyone know that we do have our walk coming up at SUNY Adirondack on October 16th. If you are interested, I can definitely get you some information on that. I'm going to pass it on over to Tess to talk about the VA.
Sure. So many of you know, we're the Veterans Health Administration. We are the largest integrated health system providing care across over 1,200 care facilities nationwide, which is 171 medical centers and 1,112 outpatient sites We are able to provide varying complexity of care for our nation's veterans. And each year, the VA nationally serves 9 million enrolled veterans. Locally in Albany, we serve about 30,000 yearly, and that includes at our outpatient clinics. And that is for everyone up north, that's Plattsburgh and Saranac Lake, Westport, those facilities. We can manage a lot in primary care, and we do engage with patients that way, not just at the hospital. So the VA mission is to care for him who shall have borne the battle and for his widow and his orphan. So we are really looking holistically at the entire family and trying to make sure that we can serve and honor our veterans as best as possible. So we do this by not just engaging with VA resources, so not just reviewing what the VA has to offer and what services we have, but also partnering with amazing community providers that can help us further support our veterans. You can go to the next slide, Molly. So when we were thinking about this partnership, we were talking about how is Alzheimer's disease in the military different than that of the general population. And part of the military culture is the stoicism that comes along with being in the military. And it often makes it hard for some of our veterans and their families to acknowledge that there is a problem or there is a need and ask for help. So some of the things that are unique to our veteran population that the Alzheimer's Association was able to help us with. And I should say that at the start of our partnership, we were able to hold several meetings about what needs we had and how our needs might be slightly different than the general population, which I feel like was helpful in engaging, educating Alzheimer's staff, Alzheimer's Association staff, as well as VA staff about the population we're working with and how we can best serve them. So part of military training would be to encourage toughness and denial of emotion. You've probably all heard these slogans before. Big boys don't cry, no pain, no gain. Although Semper Fi is actually the Marine slogan, the unofficial slogan is pain is weakness leaving the body. Fear and pain are signs of weakness. Once a Marine, always a Marine. Stubborn pride, control that conquers, fierce independence. And the biggest influence for the veteran population versus the general population is we have a large group of people who have seen combat. And often those who've seen combat are also faced with post-traumatic stress disorder. You want to go to the next slide? And what we know about PTSD and people with dementia is individuals with PTSD are nearly twice as likely to develop dementia. What's pretty interesting about this is if we go back and think about what our military have been through and their stoicism and their minimizing of symptoms, you may have someone who, now that they're elderly, now they're elderly or not, someone who's developed dementia, who's never shared anything with loved ones, is all of a sudden triggered by things that they have no idea where it came from. So this may be things that they've never shared with family before. And family might not know what they're looking at, which can be difficult to navigate. PTSD symptoms are more severe in individuals with dementia, and common triggers for those in need are being bathed, TV shows or movies related to trauma or war movies, smells, bodily odor, wounds, fires, certain foods, sounds. Certain songs can trigger something in a patient with dementia. Foreign languages, sometimes foreign doctors also upset some of these patients. Alarms, loud noises, any physical touch, especially if unexpected. And if you've talked to anybody at the VA, the docs usually laugh at residents who, will go into a patient's room and try and wake them up by touching their feet, because no matter how long ago you were in the service, that kind of instigates a reaction in you and can be not so pleasant for the person who's waking you up. And night awakenings, something that also happens a lot in a hospital or a nursing home setting. Next slide. When we look at the impact of military service on families, we're not just looking at the veteran themselves, but what did the family experience? So if this is somebody who is career military, there tends to be authoritarian family dynamics. Typically dad is in charge, frequent moving, what he says goes. So if it's somebody who hasn't shared what's been bothering them or concerns they might have, family might also continue to try and downplay what is going on with their veteran. The battle mind training, inner strength to face the fear, adversity with courage, no pain, no gain, suppressing emotions. These are families that if they have had a lot of deployment or if their loved one has seen combat, they are constantly redefining the identity role and purpose for what now. And unfortunately, we're seeing this a lot with everything that's happening in Afghanistan with many of our veterans. What does this mean for me now? All the service that I have done, all I've experienced, how does this all come into play? So it's a roller coaster, not just for the military member, but also for the family having to navigate the different thoughts and emotions that go with this. And then transition to civilian life, whether that's someone who's coming in after 4 years of service, or whether that's somebody who was a career military for 20 years. Next slide. And what makes the VA different? I would hope that a lot of you are familiar with what kind of sets us apart from other organizations. There is a huge sense of camaraderie and belonging in the VA. The vets who come here tend to have really long-term and close relationships with staff. We have so many services under one roof that it's not uncommon for Mr. Smith's cardiologist to talk to his primary care doctor, to talk to his oncologist, and have meetings frequently. So you'll have a patient who's kind of expecting everybody to be on the same team and work together, which is wonderful, but sometimes it's hard when we try to refer a veteran to another organization. So if we're trying to refer someone to the Alzheimer's Association, oh, no, I don't need that. You guys are taking care of me here, when they're actually wonderful resources that we can provide if we pair together. So when we are able to establish those relationships with patients, we're then able to cultivate and support the interdepartment relationships and make sure the patient gets as much support as possible. Next slide.
Okay, I'll go ahead and take it from here, Tess. So thank you for that. So now that you have a little background on both of our organizations, you can also see how the VA does such a good job working with other departments. And we really wanted to, internally and also with our organization, we really wanted to build on that. So we historically have worked together, like Tess had mentioned, throughout the years. We've, had referrals or worked together, touched base and would have meetings. But during the pandemic, we really wanted to build on that. And we saw how, again, especially during a pandemic, how important education is for families that are going through this disease, and also the social supports that we provide at the Alzheimer's Association, while also being subject matter experts in Alzheimer's disease. But then also the clinical treatment aspect from the VA, where we don't have that expertise. We saw how both could really fit together and help a veteran and their family. And, as veterans are disproportionately affected by the disease, it makes sense to really partner together and come up with a solution to help families that are disproportionately affected. I will just say that we were able to secure funds from a private donor for the Alzheimer's Association, which helped us staff our department in order to have more of these comprehensive consultations. So I just wanted to make that clear to everyone in attendance today. And it was really a pilot program to make a more formalized relationship, and that funding did help in order to do so. So once all those areas were secured and we clearly wanted to work together, there was next steps for something called a collaborative action plan. So when we sat down to make the collaborative action plan between the VA and the Alzheimer's Association, we really wanted to make something that was more formal, but still understanding and flexible with check-in dates and targets. That was really important. You know, both of our organizations have a lot of work, a lot of pieces, and a lot that we do. So we wanted to make sure it was a flexible relationship, but we also wanted to focus and have strategies around the areas that we felt were most important. So Tess was talking about how both of our organizations came together and identified some needs. And I completely agree with you, Tess. I know that from the Alzheimer's Association, we don't have that expertise necessarily working with veterans. We work with veterans, but not having like the cultural competency and learning how to work with the population was really important. So it was incredible to be able to lean and to lean on all of you to get that education. So we focused in on staff engagement, care and support, and improvement of dementia care. And we're going to just go through each one of these areas and what we ended up coming up with as a strategy, and then the roles that each of our organizations played. So for staff engagement, we really wanted to build on staff knowledge. Like I just mentioned, for us at the Alzheimer's Association, we wanted to build on our staff's knowledge of serving veterans and the culture of veterans in general. And we knew that when we were able to learn more from the VA, that would improve our patient experience. And same thing with the VA, we wanted to be able to teach their staff about Alzheimer's disease so they can also provide good quality care for their patients. But also we wanted to focus on the caregivers. That's another piece. So we're dealing oftentimes with families that have various structures. Everyone is different. I'm actually going to review a couple success stories about how it is a little bit different, but we wanted to make sure the families or the main caregivers were supported too, and also being culturally competent with veterans and their loved ones. So again, just a really good collaboration to learn about our areas of expertise. And ultimately, we really did want to be able to spread the awareness of Alzheimer's disease within the VA system as well. So our role as the Alzheimer's Association, we actually participate in outreach events that Tess and her team put on. So we were fortunate enough to have a resource fair that occurred a couple months ago. It was actually my first event in person that I had attended since the pandemic. So I was very excited. And I think a lot of other people were too, to get out and be able to do something in person. So we were available and on hand for specifically that resource fair was for caregivers. And so we were one of the main folks there to have information available, and a staff member like myself to talk to any veterans and their caregivers that needed that support. And also education to the VA staff. So being able to provide that professional education. And Tess actually is going to touch on a summit that was organized by Tess and her team, but I was able to do a program during that summit, and some of the VA staff was a part or attended the presentation that I did that talked about what Alzheimer's disease is, what the difference is between Alzheimer's disease and dementia, and the warning signs of the disease. So it was a really good way to get caregivers on, but also some professional staff as well. And then the VA's role was to help organize a caregiver resource fair and to plan education workshops on behalf of us. So logistically putting that all together and inviting their veterans, their staff, and then we would be on hand to provide that disease education and be that subject matter expert. So then looking at care and support, this is a big pillar. that we wanted to make sure that we were really collaborating well on. So we wanted to enhance education. Education was huge. We know that when we're talking to families, that seems to always be the missing link. And I always say you really can't battle something if you don't know what you're battling against. And oftentimes we find with Alzheimer's disease and other types of dementia that folks just don't have the general education on what the disease is or how it progresses. So we really wanted to use this strategy to use education as our main component and provide mostly to the care partners. So that would trickle into having improved care overall for veterans. And we also wanted to focus on the support services for veterans and their families. We know that the VA provides so many amazing services, and that's really where we leaned on the VA to sort of fill in for that and to explain what they provide. But also there are other community resources too that we can explain and go through with families and can just build off of the support services they're receiving from the VA. And probably the biggest piece too is Tess was talking about PTSD and some of the triggers that somebody might experience. Combine that with the dementia diagnosis, we have some really difficult behaviors that might occur. So with our expertise with the VA and PTSD, and then on our end with the dementia piece, we can help families sort out those difficult behaviors and try to help them come up with a plan to really help with the behavior issues. So looking at our roles and responsibilities, I mentioned the Caregiver Summit that Tess will expand on. So we're able to share education and talk about our services to caregivers that afternoon. It also then leads to what we call our DCC, or Dementia Care Coordination process. So I mentioned in the very beginning of the presentation that our care consultation model is, we are able to provide that to families, but we don't do follow-ups. And with the VA, we are actually able to build this into our plan and our staffing plan to do follow-ups with what's called, again, the Dementia Care Coordination process. So when we would get a referral from the VA staff regarding one of their veterans that's going through Alzheimer's disease or another dementia, we would link them to the appropriate staff member, and that staff member would have an initial consult with the family, our normal care consultation that we would have. And then they also were doing follow-ups 1 month after, 3 months after, and then 6 months after the initial consult. So it's different than what we normally provide, and we've definitely seen the positives from that with the follow-ups for the families. And then also we did have Tess and her team come to our program, our care and support meeting, to give us some training, like I mentioned before, to be culturally competent, working with veterans that the VA is trusting us with and referring to us. So Tess was able to give a great overview and discuss some of the culture of veterans for all of our field staff, myself, and others involved in the project. And then the VA role was to plan the Caregiver Summit that I was a part of, and you'll hear more about. They also are responsible for sending the referrals over of their veterans to us. They take the lead on that and take initiative to get their families connected to us. And obviously, with how much trust and support the VA provides their veterans, it's really helpful for them to be that warm handoff, so the family will be more apt to use our services and feel like they can trust us. Also, the VA does an amazing job of sharing our education programs that we have available. We are doing some in-person, limited, but a majority of our programming is virtual at this time. But I know Tess and her team share with their caregivers, with their families, the education programs that we're doing, and we do several a month. There are many options, whether it's in the evening, earlier in the morning, and we try to give many options for families to log on. And then again, just giving us that expertise and tips and engaging veterans with our staff. And I'll pass it on over to Tess.
Yeah. So I know that we're all from different healthcare organizations, but I'm sure we can all relate to, I know with our providers, when you have a neurologist who's diagnosing a patient with dementia, it's one thing, they feel comfortable with the diagnosis. Unfortunately, fortunately, a lot of dementia diagnosis, whether in the community or the VA, it happens at primary care. But primary care is a little hesitant to actually make those diagnoses without having additional support or guidance, or I'm going to tell someone they have dementia and where do we go from there? So the Alzheimer's Association and this partnership has been huge at educating our providers, not just our physicians or nurse practitioners and our physician's assistants, but also nurses and social workers and psychiatrists about what resources are available and what memory loss is. When we had initially looked at this partnership and I was working with the Alzheimer's Association, I was pulling all of the different diagnoses that could equal Alzheimer's disease, what would be appropriate for dementia. And there were like 25 different diagnoses that would fit the same criteria, which is very overwhelming, not only for the veteran with the diagnosis or the family getting the diagnosis, but also the provider on what to choose, what's appropriate. So it has been amazing and our providers have all really appreciated having that extra layer of support, being able to ask questions, frank questions about what they're doing, what their practice is, how do you feel about this, just getting that extra support and encouragement to help make those diagnoses and make sure we're getting these veterans the right care and support that they need. So we have been able to improve timely detection with that. The care management is lovely because our social workers who are already working with these veterans feel that they also have an added layer of support. And it's all obviously about the patient and the family living with this and how to provide the best care. So for one of the most amazing things, the recommendations into care action, we've been using a lot of this for our outpatient setting, veterans who are living at home. And I did sneak, and I probably wasn't supposed to look yet, in the questions about, is it common for vets who might experience PTSD and dementia to be violent? What's interesting about that is sometimes we get referrals from nursing homes. So although the VA has a nursing home, it's only for a small population of our veterans. The majority of veterans are at other facilities. And sometimes a vet might become agitated, not all the time, but it can happen. And the behavioral modifications or the recommendations, where do we go from here? We're often asked to go into the community to make those recommendations. Sometimes it's hard for a family to hear what the recommendations are. And one of the benefits of partnering with the Alzheimer's Association is we have professionals who are supporting the same thing, the same message we're giving to the family. So, and again, I'm sure we can all attest to that in working with people. When you have 3 people in the room all saying the same thing, it's easier to share the message and it's not coming just from one person. Likewise, when you have, this is a difficult diagnosis and this is a difficult lifestyle that we're now forced to live with. When you have more than one professional, more than one agency sharing the same message, it makes it easier for families and the patients to digest and get the support they need to move forward. We have, what we've been offered through the Alzheimer's Association is the Essential ALS training, which is great for our LPNs and others who might not work with people with dementia as frequently. And it kind of guides them on what to look for, how to approach people. And it just is another layer of support for these individuals. And we, as Molly had mentioned, I have a monthly newsletter where I'm able to share all of the information and all of the resources Alzheimer's Association has with our caregivers who then can access it. So, and I know, I'm sure, because I've had these feelings before too, when we're working across agencies, sometimes it's like, wait a minute, we do that. Are we giving away our business here? But really to be able to work together to support the common goal has been pretty amazing. And we, again, have been sharing the Alzheimer's Association education and staff resources with our Dementia Steering Committee, but also the hospital as a whole. What's the next slide, Molly?
That is, it's time for successes.
Yay.
That's a good thing. So yeah, it just, as Tess has said, it's really been a great partnership, and we have a couple cases here I just wanted to share. One is in Albany County and one is in Washington County. So in this particular situation, the VA referred to us for the DCC program, and our Albany County program manager started working with this individual. And this is a little layered here. We see this all the time at the Alzheimer's Association when we're working with just families in general, where there is the adult child who is sort of steering the boat and is wanting to learn more. And then there's also the the individual that's living with the person with Alzheimer's disease, and they're sort of getting the day-to-day brunt of things, and they're in the weeds a little bit. So oftentimes we find that older adult children are looking for the education and a place to start so they can help get their mother, father, in this instance, mother, out of the weeds a little bit and get support for her as well. So it's tiered. So the Albany County program manager started working with this individual. His father was actually a veteran. His mother lives with his father, who is living with the disease. And what they started to come up against was combative behavior, the verbal and physical abuse towards his wife. And so the son really was at a loss for how to control this and what to do. There was also a driving piece that was added to this, and we know driving is incredibly difficult. I will say that one of our strengths at the Alzheimer's Association, I actually just did a program last night. We do programs on how to talk to somebody about driving. We give people ways to approach it. We give communication tactics. We give some roundabout, what we call therapeutic fibs, those types of things that help families get to this problem, because driving is very dangerous with someone who is living with Alzheimer's disease. So the program manager was able to give the son education about the disease, about communication. He learned that maybe some of the ways that the son or the wife was approaching their loved one who is living with the disease is actually triggering him. So asking a lot of questions, sort of testing him sometimes, or quizzing about what he knew, that was setting him off too. So there's things that as a caregiver or as a family member, we have to recognize that we have the ability to change. The individual that's living with Alzheimer's disease or a type of dementia does not, and they do not have the ability to reason. So this is where our program manager really helped this individual. But then also the program manager had asked, what support services can we get for you as the son and for your mom? This is, just like Tess said, it is a really difficult journey. It's a long journey, and we really need to make the family and the care partners a priority, and we have support services for them. So he worked to get them in a support group that would fit their roles. So what's really nice about some of our, again, I mentioned our specialty support groups, we have an adult child caregiver group. And then we do have groups that are more, they're not labeled as spouses, but we've seen in many of our groups, a majority of folks that are joining that as caregivers are spouses. So as the person, the program manager, the staff member that's the expert in Albany County with our services, he was able to help them find the right group for them to get support. And also because of the difficulty of this case and some of the verbal and physical abuse that was taking place, our program manager was actually able to meet with the VA staff and Tess's team to talk about, hey, this is what I encountered in the initial visit. This is what we talked about. I want to tell you about some of the strategies I gave to the son, just so you are aware when you're working with the family. So The VA staff also had some good solid information about what we had educated the family on. And we also were turning to the VA for some support for ourselves. Like Tess was saying, it's so nice to be able to have another professional to sort of talk about these cases and what's the best, what are some of the best services we can provide for the family. So it was a good way to come together and talk about this more difficult situation, which they are doing much better. And then in Washington County, we saw that an individual was caring, we were again referred to the DCC program from the VA staff to us, and the wife was caring for her husband, who is a veteran. He has a vascular dementia diagnosis. And the reason why I wanted to point that out is that oftentimes we, and understandably so, because we're the Alzheimer's Association, many folks will think that, oh, in order to work with the Alzheimer's Association, I have to have an Alzheimer's disease diagnosis. And that is not the case. We actually help with all and any forms of dementia or any type of memory loss. We recognize our limitations and expertise, but we know that there is a lot of woven parts with other types of dementia. And oftentimes we will link families to other associations that specialize in that type of dementia, but our programs are tailored for all types of dementia, and we are able to provide good quality to those that are living with other types of dementia. So vascular dementia is the second most common form of dementia, so we see this often. But I just wanted to make sure you all were aware. And then again, this is where we saw the individual was having more violent outbursts, just getting really upset and yelling. And mostly this was because of a financial change and a selling of a house. So we see this with a lot of folks with a type of dementia where they get very paranoid about finances, about money. That is something that you might see as a common warning sign. So it's not uncommon to see folks that really have difficulty or behavioral issues stemming from that. And when the program manager met with the wife, she found out that she was saying that she had help. And she kept saying that, but then when we were digging through, she only had about 6 hours per week. And so during COVID, especially, she was just getting errands done and coming back and running back, and wasn't really able to decompress and have that time for herself, or maybe do something that she likes to do besides just running errands and doing things for the household. But that's why she was becoming increasingly overwhelmed and isolated. So the Alzheimer's Association staff was able to, again, provide that education, specifically about communication. We did notice that with this individual, just changing her approach with her husband so he wouldn't get as upset about the move, and giving her some ideas with therapeutic fibbing to not always harp on the money and the sale of the house. I have a program that I've done throughout COVID that I created because I have a background in recreation therapy, and it's called Meaningful Engagement during COVID at home. And so that was the other thing that the wife had said, that their loved one was becoming increasingly bored. There wasn't formal or informal supports visiting. She just felt like she couldn't keep him engaged all day. And that was a part of the overwhelming piece of this. So she was able to attend a program that I put on that really gives you concrete and simple ways to keep someone engaged throughout the day. And then also we wanted to link her to a local support group. And I'm going to pass it over to Tess to talk a little bit about the summit.
Sorry, had to unmute myself. So we were able to hold a summit this year this was actually a professional summit for our staff members. And this again coincides with what we were talking about with having more education to providers. And what was great about this is Molly provided education on brain health, but it was across so many different professions. We had psychiatrists, we had doctors, we had nurses, we had social workers, just kind of empowering all providers to speak up about what happens when you identify a problem. Again, this is something that I'm sure many people can relate to. What do we, we might identify memory loss, or we might identify this concern. What are the next steps? And Molly was really great at sharing that. And because we were able to do this in a summit situation where we have not only our providers, but providers from outside agencies, it seemed like it was a more natural, comfortable situation to then have these providers ask for more information from the Alzheimer's Association and request further education.
All right. So just to talk quick about the internal structure, because we know that with the summit that we wanted to be able to give you all tools if you wanted to emulate this type of collaboration with a voluntary health organization and a health system, how it can be done. And I think, again, I mentioned the private donor for us that helped with the staffing, but what we decided to do with the DCC model, so that consultative model, was to make sure that we are having families work with the staff that are living and working within the communities that they serve. We felt that that was really important because they know the community resources, they know the community the best, and they still can provide that, that education on dementia. So anyone that was referred to us from a specific county was then paired with what we called our staff partner for the family. And we've really seen that this internally helped share the workload. You know, my director of education and outreach, we initially, when we were coming up with this partnership, we were like, maybe the two of us can sort of do this model and the education. And I think it's really important as an organization to make sure that you're doing this in the right way. And when we talked a little bit more about it internally with other leaders in care and support, ultimately the consultation piece needed to come from people that know the communities the best. So we decided to share that workload, and it's been a really good process. We have an internal, you know, as soon as we get a referral from the VA, we have an internal referral system that we use. There is some additional documentation, I should note, that we do for this program that's then used for the VA. So we also just wanted to make sure that the staff are building this into their schedule, because it does require a little bit more paperwork. It does require more of the follow-ups that they're not usually doing. So overall, it's been amazing. It's definitely the right way to do it, and how we shared it with our field staff. And then our director of education and outreach and myself, the associate director of DE&I, we focused on the professional education and caregiver outreach events that Tess and her team are putting on. Will be a part of more of that outreach piece and the education piece. So it's been working really well because all of our team is immersed. And they also were able to learn a lot from Tess and her team in order to carry this out in the field.
So I have talked so much about all of these things that we've already done, but something that Molly is mentioning, which is another benefit, is, and I'm sure this is something that we can all attest to, you hear of a service that you want for your patient and you think, oh, that'd be great if we could get that for them. When we are able to work together as two agencies, the Alzheimer's Association can say, you know, I heard about this program where someone's getting paid to take care of their loved one. Is this veteran eligible? And sometimes they are, and sometimes they aren't. But having that extra layer of a person you can talk to and review what resources we have before they offer it to a patient, or say, you know, I've heard of this, but I don't know, it's been helpful for our patients as well. We have spoken, the Alzheimer's Association has presented to our primary care, educating them about services. I just talked about how we went over sharing benefits and resources. And that's another thing that I'm sure other people can attest to. The VA is a little crazy in what someone might be eligible for and what someone isn't. And it's kind of an if then but this situation. So having that one person you can call to ask those questions to, I think has been helpful. And Molly, you can correct me if I'm wrong, has been helpful to the Alzheimer's staff. So yes, they might identify a need and we can partner together to see what we have that might be helpful.
Definitely.
And again, the care consultation has been amazing. So that's what we have been doing. We've reviewed with all of our staff and lots of areas throughout the hospital what the Alzheimer's Association has in this partnership and how to access it. Though we have, I'm the person who refers to the Alzheimer's Association because we have a limited number of the ongoing case management slots. I think we probably increased our numbers for general referrals, but that extra piece, I kind of screen them to see if this is appropriate or if just the general consultation would be enough in that situation.
So I think you've heard us say how beneficial this partnership has been, but really the biggest piece is that social support and the clinical care is connected together, and we really lean on each other from both organizations and our areas of expertise. And we will keep working together and keep providing professional education for both teams. I know our team has, when Tess did her presentation and gave us that education, they were just so excited to learn and be able to provide better services for the families that we serve. So this will continue. And ultimately, it really does support the staff, but that also supports the families that we all serve. So it's a huge benefit for the community. And with that, we are done with the presentation. Does anyone have any questions for us? Questions, comments? Our contact information is here.
Thank you guys so much. I have not seen any questions pop up just yet. I don't know if you want to check yours because I know Tess, you got a private one because you.
I did.
So.
And I got another private one. I feel so special. Mary, you have made my day. This is another question for Mary. Can you speak a little bit about substance use and PTSD, dementia, etc.? I've seen alcohol and other substances exacerbate behaviors. Often a vet is not interested in rehab and recovery. Unfortunately, drug use, substance abuse, alcoholism is also more prevalent in the veteran population than it is in the general population. So in general, that's a problem that we have. And you are right, it definitely makes things worse when you have someone with a memory impairment. Just like any client, we can't force someone into treatment. Unfortunately, sometimes the disease and these behaviors cause situations where it's then out of their hands. So in situations like that, and I don't know where you're calling or where you're from, but this is a situation we might partner with the Adult Protective Services of the county and let them know the situation, depending on what the behavior is. So what they are doing when they're using alcohol or using drugs. Then we can partner together to provide resources. And again, this is something that happens often where they reach a level where they have done something that you can't undo. And then we're in a situation where they're no longer able to make those decisions. And sometimes, and obviously, and I'm sure Molly can speak to this as well, excessive alcohol use and excessive drug use can impact your memory and cause dementia much sooner than had you not engaged in those activities.
Yeah, Tess, I was actually just going to say it's sort of, it feeds into everything because there is an alcohol-induced type of dementia. It's one of the several types of dementia, and we do see that alcohol abuse does raise that risk for developing a dementia. So it does, make sense if people are battling multiple disorders and which leads to potentially a type of dementia as they're aging.
Perfect. Thank you guys. Molly, I don't know if you've received any private messages as well.
I am not as special as Tess. No.
That's okay.
Tess,
I
you're
haven't
special.
received any.
I feel so
Yeah,
important today.
That's how we try to make all of our presenters feel. So that's our goal. I'll leave it open for another minute or so just to see if anyone has any questions. As always, like I said, the recording and the slides will be archived on the webpage. Along with that, in the description of the YouTube link, which is what will be archived for the recording, I will make sure to include Molly and Tess's information so that we can, make sure everyone has access to it. And if anyone does have questions afterwards, please feel free to email Molly or Tess, or even email anyone on the summit planning team or ahisummit@ahihealth.org, and we can always get those questions over to them. Not seeing anything come in, so I think we'll take a little cue from one of our earlier sessions today and give everyone back a few minutes. So thank you guys so much. I appreciate it. It was a great presentation. You're getting a lot of nice comments coming in, both privately and here. Mary said, excellent presentation, great information. It's wonderful to see the collaboration between two programs. So thank you guys so much.
Thank you.
And we will see everyone tomorrow at 10 a.m.
Take care.
Thank you. Bye, Tess. Thank you.
See you later.